Welcome to the Prioritizing Prevention, Translating Science to Practice podcast. Our goal is prioritizing prevention conversations that matter. Our topic for today is celebrating 20 years of the Strategic Prevention Framework, or SPIF, with special guests Tracy Johnson and George Hicks. Now here's our host, Holly Raffle.
Hello, and welcome to Episode 9, Season 2 on Prioritizing Prevention, Translating Science to Practice. This podcast is hosted by the Ohio Center of Excellence for Behavioral Health Prevention and Promotion. My name is Holly Raffle, and I have the privilege of serving as the faculty director of the center. This month, the center is celebrating the 20th anniversary of the Strategic Prevention Framework, or what those in the field affectionately call the SPIF. Today's podcast will reflect on the progress we've seen in prevention because of the SPIF and the implementation of SPIF in organizations and communities. I hope that today's podcast will be both conversational and reflective in nature. Today, we're joined by Tracy Johnson, principal of TTJ Group and former Regional Technical Assistance Director for the Substance Abuse Mental Health Services Administration, which is abbreviated SAMHSA. And Mr. George Hicks, who is an Ohio Certified Prevention Consultant and the president of Arkbuilders, a nonprofit located in Franklin County, Ohio. Tracy brings a wealth of experience and expertise to the conversation. As the former director of SAMHSA's Center for Substance Abuse Prevention Central Regional Team, he has led projects and worked with states and communities on effective substance use prevention strategies and using SAMHSA's SPIF. He continues to do that very same work today through independent consulting. Tracy, I can't believe the SPIF is turning 20.
Happy anniversary.
For our audience, I learned about the SPIF from Tracy in 2006, and I remember that time frame easily because I was expecting our second son when I went through that training in Indianapolis. Our youngest turned 18 in September. Tracy, I am so grateful that our paths crossed and we've been spiffing across Ohio for all these years.
Yes, we have.
Well, I've only had the pleasure of working with George for 10 years this December. I can tell you that I've learned so much from his willingness to share his experience and expertise with me. I am so grateful to share this conversation with you, George. As the president of Arkbuilders, George has over 25 years of experience in program development. He coordinates programs both in schools and community settings. He works to identify the prevention needs of target populations and has extensive experience working with urban youth in the Columbus, Ohio area. Welcome, George.
Well, thank you. It's a pleasure.
In this episode, we'll discuss the origins and evolution of the SPIF, including its motivation and goals as established by SAMHSA. We'll also delve into the practical aspects of implementing the SPIF, with specific outcomes and the challenges faced in various communities and organizations. Finally, we'll identify opportunities for introducing the SPIF to new sectors, emphasizing its potential to improve the health of Ohioans across the state. Again, welcome and thank you both for joining us, Tracy and George. I am so grateful to have you today.
Thank you for inviting us.
Thank you, Dr. Holly.
So our listeners really enjoy getting to know our guests, as we say, beyond their bio. So we always hold some space in the beginning of the show where you can share with our listeners something about who you are beyond your bio. Maybe a little bit about what your work looks like on the daily, which part of your work you enjoy most, or a little bit of like a nugget or something about who you are as a person. Tracy, how about you?
Well, I'll start out. Thank you, Dr. Raffle. I'll start out just a little nugget about myself is I have 6 beautiful grandchildren. One is a great grandchild. And my work in prevention is these last few years is dedicated to their legacy. That when they come to our great state of Ohio, that I've had an input in working with organizations like Ohio University and others on this effort to really make sure our communities are safe and drug-free. So I have a great grandson, believe it or not, and he is 7 years old. So it sort of ties into the work that I've been doing for well over 30 years. So excited to be here. That's my nugget that I want to provide, if that's okay.
Oh, absolutely. Thank you, Tracy. How about you, George? What would you like to share with our audience?
This is a casual conversation. I need to say, first of all, Tracy just took my legacy time, but Uh, and I consider him a real coach, and we'll get into that more. But for me, it's working within our communities. For years, I have 4 kids, children, 2 grandkids, but we really are in legacy time. I just want to leave behind a framework for our communities to thrive. And that's why I love the spiff, but we're not getting into that yet. But that's what I would say. It's legacy time for us. We get excited about this. Um, the spiff, the strategic prevention framework, has been a lifesaver for my work.
And, you know, a lot of times when I think about it, Dr. Holly and George, when my work at SAMHSA with the Central Region work that I did for SAMHSA, when we talk about legacy, SPIF, Strategic Prevention Framework, in its above itself is a legacy. Because although wonderful work was being done prior to that, the creation and the implementation and the execution of the strategic prevention framework and its uniqueness and changes have been a legacy within itself. And it's good for our Ohioans to understand and know across our state.
Oh, 100%, Tracy. And it is my understanding that you were in the room when the spiff was born.
Yes, yes.
With your extensive experience in prevention, can you tell us about those beginnings?
Well, uniquely, I started in prevention before I came to SAMHSA, CSAP, and was doing the basic things like others were doing in the early 90s and late 80s. Writing down who came, just trying to do the work of prevention, not having a true direction, but being able to be a part of the Central Region uh, Center for the Application of Prevention Technologies back in 2003 and 4. I remember being called into a meeting, a national meeting that we all came to, saying that there's going to be an adjustment, a change, if you will, in the way that that SAMHSA was funding its communities, and that our role as technical assistance advisors and around the country was to help support our state systems, who will eventually support our community systems, and understanding this role. And at that time, Beverly Watts Davis was the CSAP director. And it was her and several other of those leadership folks who came to the room and presented to us this new thing called the Strategic Prevention Framework. And the focus was to put a framework, to put a process, if you will, around the already good prevention work, but to establish it even more so that we can count and really justify the good work that's happening in the community, but in a way that everybody's using the same process. Starting from the state systems, they were the first that had to do it, and they had to get used to doing it. So my role, was to work with Ohio and other states to work with those national prevention networks, individuals and representatives to really say, hey, you're getting this announcement. You're going to have to be doing your block grant dollars in this direction. And our role was to help support that by helping them roll out the strategic prevention framework in a way that's useful for them and answer any questions they had. But then also they would have the ability to really respond to the communities that they were going to fund as well.
So you've really seen it from, here's this conversation of we need training and technical assistance providers to understand the spiff. Now we need states to understand the spiff to bring communities along in using a framework that unifies prevention.
Yes. And uniquely, it was for the first time, from my viewpoint, sitting in a room that now we're going to organize something that all communities can do. Rural Appalachian, urban, frontier, Native Americans, suburban communities can begin to attack something and attach something that can work in their communities. Hearing George talk about it earlier just says that's where was the true expectation of the strategic prevention framework, or SPIF, was supposed to be laid out to the folks who are from grassroots organizations and beyond, to give them a process, if you will, of something that really they can take and really hold on to to be effective in measuring what's really working, what should be working. And in a sense, what I call become the physicians of your own community.
Absolutely. To use that data and information to diagnose
Yes.
and then be able to choose the right intervention at the right
There
time.
you go. That's right, Doc. That's right. And so to be able to know your community, not just because you feel it in the back of the hairs of your neck growing, but you know it because when, like any good physician does, he or she may know by looking at you, but they have to do some other measurements to make sure they know the problem. And the strategic prevention framework was the real first process of doing that. So then we can all prevention folks can go into their communities and really assess what's needed and begin the process of change.
And George, I mentioned that we first met 10 years ago this December, and we met at an Ohio Adult Allies training where the topic was using the SPIF with young people to create spaces for youth to create the changes they wanted to see in their communities. So, can you tell me a little bit about what drew you to the SPIF and adopting it to the structure of your work?
Sure. Like you said, it's been 10 years, which is amazing. Um, and I like to go back and just say before that, like most people who are in this field, we are driven by passion, by our concern for our community. We see a need and we want to address the need. And a lot of times and I don't, there's nothing negative about being uh, emotional and passionate about an issue. But what the SPIP did is gave me framework for my passion. I love to say that anymore. It gives you a framework. So I was invited to this meeting, um, and I sat in the back and listened. And I always joke with Dr. Raffle, you didn't invite me, but I snuck into me, in the back, and it just resonated about, ooh, this really, we can use this. Our communities need a framework to do our work. So that's how it happened. And you have not been able to get rid of me since then. Uh, I am a spiffer. We call them spiffers. We spiff everything. So that's where we began. I was working in Columbus in an urban setting, and we began to spiff our Team Leadership Academy. And I could talk about that later, but the results from that is phenomenal.
Can I add, Dr. Raffle, is that uniquely when we were in the walls of SAMHSA, when we were invited as technical assistants, directors, and providers to come into that conversation, this is exactly what folks like Beverly Watts Davis and other leaders wanted to see happen. Although we knew it had to start at the state, but the idea that George just described and how the SPIF would be sort of rolled out is exactly what got me percolating or excited, because coming from a community-based agency before I got to SAMHSA, that's what I wanted to see. And to be able to have something like that still be a part of community folks and to impact them in a way that they can be effective was the actual idea of the framework and its development. It's been through serious other iterations, but it still has the basic contents of what it is. And I applaud to talk about this during Prevention Month here in October.
Absolutely. Thank you. And George, I'm just curious. So you go to this training, and then what's your next step? How do you get buy-in from others to even be curious about and then adopt the SPIF?
Well, I was fortunate enough to be one of the leaders in our work. So to me, we begin to implement it, and you begin to see the results. And once people begin to see the results, particularly even not even our young people saw the results because we had a roadmap, and you begin to see the outcomes. Then people say, "Oh, how did you do that?" And by then, this thing called the Strategic Prevention Framework. Uh, part of the incentive was the state, OMAS, Ohio Mental Health and Addiction Services, was requiring us to begin to implement the SPIF. So it just worked out. And the result, our young people implement the SPIF. And they have learned to do the spiff with the issues that concern them. Once you see success, people want it. And then it gives you confidence. So now we work with other communities, and you really don't even have to convince them. This is the way, if you want to reach your community, you really need to have this framework in place.
And George, can you think of like a specific example where you've seen the spiff work in a community and share that with our audience?
Sure. Again, I'll go back to the original one. We were working on the south side of Columbus about 2013. You remember there was a mass shooting in Newtown, and President Barack Obama called for community conversations around mental health. At the time I was running this program, we'd have about 75 or 100 young people in the center every weekend. But we also had a group of young people that we were working on leadership. So they came to our center and they wanted to have a community conversation to assess the question was, what do we need to do for the mental health of young people? So our young people told us, this is what we want. And it was basically 4 things. We need jobs. We call them healers who look like us, culturally appropriate counselors or healers. We want to get out of our community and see new places. And we want to get back to our community. So it's 3 leaders, 3 or 4 leaders. And we said, this is what our young people have said. Now we need to implement that. This was before SPIF. So we were just trying. But once SPIF came in, then we began to understand, okay, this is what our young people have said. The data supports it. Now, what resources do we have? The bottom line is we said we need to start with summer employment. Now this was years ago, we've hired over 400 or 500 young people. They've come through our system. They learned the SPIF, they learned behavioral health. And we have 3 centers right now are staffed exclusively by young people who have gone through who've been a part of our Teen Leadership Academy. It's gone to other parts of the city. Now we're working with immigrant communities, and we'll talk about that later too. But you asked me for one. That's where it started. We have videos. Our young people develop videos, youth-led videos around the SPIF. They SPIF things themselves. We say any issue. I know we're talking behavioral health, AOD, mental health promotion, but any issue in our community can be SPIF.
That's right. And one of the things, can I also add, Dr. Holly and George, was I remember when we were doing the planning, it was that we wanted the state systems for the first time to knock down those proverbial barriers of partners that were at the state level. You need to have a conversation with universities. You need to have a conversation with regional folks. You need to have a conversation with atom boards. You need to have a conversation with folks who keep the data that you don't need to have a conversation with. You have to have more of a collaborative, not collaborate and beat each other up, but more of a collaborative nature at the state level. And that was the first initial strong hurdle that we did. But Ohio did a great job in implementing it. I mean, they were open to the opportunity. I remember meeting you back then, Dr. Holly. And you are, and many other folks at OMAS and others. It wasn't OMAS then, but many of the other folks were amenable at first, although they were wondering how this would work with the old way of doing it. But they were amenable and looking at bringing partners together to create, that data committee, that ecological group, that group that could really look at data and really perform that work, and then who could do an evaluation, who could do the sort of the capacity level. It was so critical that states had to do it first, and our role was to be trained on how to communicate with our state systems to help them see the importance of implementing, being a spiffer, if you will, George, at the state level, and doing it that way to be effective.
And it's funny you bring that up, Tracy, because I remember Kamisha Bennett at SAMHSA She says, when I go to a community and say, how's it going when you implement the spiff? And they tell me, oh, it's great. It's easy. She's like, no, I know they're not doing the spiff because I can see it in people's eyes when they've done the spiff because it isn't easy to implement. However, at the end, the juice is worth the squeeze.
Cool. Yes. Yes. Yes.
Yeah. So I was just curious, like, what challenges, have you seen, Tracy, across the nation with community leaders and states, what they encounter with the spiff, and how are those challenges addressed, and how do people get to that other side to become spiffers like you, me, and George?
It's really it's a combination of leadership, network, and true communication and engagement. One of the things that I know in some states that were sort of pushing back on the SPIF process, some of the leaders were not just buying it at the time. I mean, it's important that state leaders who are in the substance misuse prevention field, who are even at the governor's level. I remember us approaching many of the governor's staff folks. At that time, it was Governor Taft and his folks that presenting it to him and his assistants, his support staff, and then presenting it to the folks at at the state level was so important, and he bought into it, and his wife, Mrs. Taft, really bought into it as a critical piece for us to get it going. In a lot of other states where I was witnessing, particularly the other 9 states that I was blessed to oversee, I would say only 3 or 4 of them outside of Ohio really took in this framework process with an open mind. And so, some of the difficulties were that folks were not used to collaborating. Folks were not used to, at state levels, communicating with each other outside their state agency. And what we were doing was we were asking states to tear down those proverbial walls and begin having conversations with youth justice, with all the different education, having tearing down those walls and having a conversation about how can we create a really good methodology that we can get our young folks substance free or prevent it from happening at an earlier age. And so one of the things we knew that we had to incorporate was get the leadership involved, from the governor's office on to the state agency and down to the Adams boards and community members. We knew it took a collaborative approach to really go in. I remember those first 2 or 3 or 4 years. Sometimes it was difficult in some other states to really want to implement it because they had those schisms, those isms about sharing information and sharing the documentation and sharing ideas, to just form, the group that really is going to look at the data. The ecological, group was there was going to look at that data. So we had many meetings with state systems. Unfortunately, not as difficult. It was a challenge, but not as difficult in Ohio. But other states that I was responsible for, I won't mention them, but other states it was having some tough times, really trying to bring that process down. And it all starts with the leadership. And I think that opens the doors for folks to say, yeah, we can break down the proverbial walls. We can have a conversation.
Absolutely. And George, I know you've done extensive work in the Somali and the Somali Bantu populations. Can you talk a little bit about the leadership there and how that's been useful and supportive in breaking down barriers?
Sure. And I just want to piggyback off what Tracy said too, as far as the challenge. And it goes within our Somali Bantu community. It's just believing in the process. It's hard to say. Most people think about, give me a program that'll work. And for us, we say, look, this is a framework, this is not a program. And you have to learn the process and let it work. So let's, our Somali Bantu people, just to talk about data. It's like, that's different. We have a problem. We just need to address the problem. we said, no, we need to slow down. This is a process. Once we get through it, we'll see results. But you have to believe in the process. For me, that's the biggest thing. Give me a program. Tell me the 10 steps that we need to do, and at the end, we'll be successful. But our framework is it's a living thing. And our communities is like, it's new to them. It's new to all. It's new to all of us at first. And we just want to get to Z. I don't want to talk about building capacity. In particular, if you come through maybe a background of abuse, and so that whole trust thing, I'm gonna trust different people. I could go into that between Somalis and Bantu Somalis. I was working in a mosque and begin to hear these things about a different group. And I just happen to know some people. I asked them, "Are you Bantu?" I'll always remember this. And their face just lit up. Someone sees us. So what do? Can we have a community conversation? We don't want to be culturally inappropriate in our work. And it's just led to them. They bought in because they're in some ways they're more community minded, so they understand working together. And and when you come from a background where you're a refugee, you know you must work together. And two communities like this is what we've always wanted. We know what our issues are, but we didn't know how to address these issues. And this framework gives us a platform to begin to address issues. And it helps us. We know it takes time. They know it takes time anyway. But the framework helps them. Okay, let's put if we do these things and continue to work on them, now we're beginning to see results.
Dr. Holly, I think what George is saying is paramount. Even was at the state levels, was getting the state systems to understand that the cultural competence and the sustainability piece of the framework was so critical. And what we were trained to do from our SAMHSA level was to let communities know that this is the framework is a guide. Now, how you use the guide in your state was really, really up to you, but it's so important that you define your state based on the framework and not look for the federal government to define it for you. And that was such a difficult task for state systems because they wanted to be taught how to do it, but that wasn't the purpose. And now to see where it's doing it now and how things like George working with the Bantu population and that was the whole essence of the middle of the framework was cultural competence, and that we wanted state systems and community systems to define what that meant to them, not have the folks at the federal government tell you what that meant to us. And so that was such a difficult task because before the framework, they were used to getting orders and implementing those orders. So the framework, the SPIF, was the first time saying, here's the guide. Now you have to implement it that best fit your work in your community, which was a whole new direction for funding prevention. And I applaud the folks back at SAMHSA and at HHS for this opportunity of bringing this framework. Why? Because we were able to share it with because of our partnership, we had to show it there at the federal level. Now, many organizations, many government entities like Department of Justice, Department of Education, they're all using portions or parts of the framework as a unique piece for them as well from the federal level. And to see it happen at the state level, that was the whole idea and that's probably why it's still around 20 years later.
Yeah, absolutely. And even though the SPIF is celebrating its 20th birthday and with October 2024 being Prevention Month and the theme being Tell Prevention's Story, right?
Yeah.
Love this, telling part of prevention's story, but I think there's more opportunities on the horizon. So George, as you work with youth and young people to create community change, where do you see opportunities to introduce the SPIF to young people to use that as a guiding framework for change?
Wow. Where don't I? I mean, I drive around and I see opportunity everywhere. Um, you know, uh, we do urban work, but also we see it for rural areas, suburban areas, immigrant groups, faith groups. We've been in mosques, we've been in temples, we've been in churches. The spiff works. And most of us adults, we want a way to pass on to our young people something that works. Tracy and I talk about, we talk about what if Black Lives Matter understood the spiff? What if uh, another organization would have understood how to really do community-based work?
What if the civil rights group knew about it? What would that be like? What would the women's movement be like if they knew about the spell? Yeah, we had those conversations.
Yeah, we have friends, because of our adult ally uh, collaboration in rural areas. And when I get to go to rural areas, I just say, wow, if they would spiff this.
I feel that the future holds it holds a great opportunity. And why do I say that? It's primarily because the framework is a flexible, uh, useful, engaging tool that first encompasses conversation. Next, it encompasses to review where you are and what your population looks like. And then thirdly, it brings people together because you can plan out some stuff to really focus on what you want to do. And George is a living, breathing example of that with the Bantu populations, with the other urban communities, because everyone is so different. And uniquely, the spiff is part of what public health has always been doing in so many different ways that it allows us to partner and go hand in hand with each other with public health and say, we got this thing together. We can do this process and we can engage other communities. I do a training on the 5 Ps, and one of the Ps is process. And when I go to the P of process, I use the framework as my slide because what I say is the most important thing of doing good prevention and engaging communities with the 5 Ps is you got to have a good process. And the best process that I recommend for you and now in future is because it's the framework, because it lays out for folks a really good method to really take a look at what they have, where they're going, and what they can be doing. But it says you can't do this thing alone. You can't be on an island of Panamist and trying to do it by yourself. And it takes collaboration and engagement. It takes for you to knock down those barriers and those walls, to really engage other folks that you normally wouldn't engage in a real sound conversation and discussion, to really impact your identified population that you want to work with. To me, it could be done in suicide prevention, which we're trying to do now. It could be done in education. It could be done in other sort of related youth violence prevention. There's so many opportunities. Wouldn't you agree, George?
I agree. And, we're working with the Center of Excellence now to go around the state in our BIPOC communities. And we know that Cleveland will be different than Columbus, Cincinnati will be different than Lorraine, but the framework works. And the beauty of it is, for me, my joy is that we get to go in and learn because every community learns. I mean, we work with the Arab community, working with the Bhutanese community, Latino community, and each one is different. I mean, it's not like one is an expert. You don't have to do that anymore. You can just go and look, I'm coming to learn. But we know this framework will help once we learn as we're learning your culture. So for Ohio, it's just wide open.
And if you are a sound, good person that want to see community change, you're there to listen. And the framework allows that process for you to be a sound facilitator, to get the community to feel like they're bought in and that they are part of something that's unique. When I think of the spiff and the framework, that's probably one of the easiest things to bring as a facilitator to the table when you're trying to do a town hall or community engagement. and that it can be used in schools, it can be used all over. And I think just taking them through, well, how can we come together about what does the data say? Let's break up into groups and look at the data. Who are we missing? What other folks can we bring to the table to build capacity, to help us do this thing? Oh, you know what? Now we got everybody at the table. We know what the data says, and we know the level of readiness for our community. Let's really plan what we really want to do, and let's all of us do it collectively. And to have that plan, and now it's time to implement. But see, before as I would say, pre-spiff, it was just get the money and implement.
Yeah, go get it.
And for the first time, there's somebody who knows how to facilitate groups to take this and do something with this. I even think in recovery. I even think in harm reduction. I mean, the strategic prevention framework, the framework itself is a guide for us to use in a way that's going to let people feel empowered and engaged. And I think that's, to me, is what I see as the future of the framework.
Wow. I think that's a good place to leave our conversation because we're just ending on such a powerful note. And bottom line, as George said, the spiff works if you work it. And it takes that work, but the juice is definitely worth the squeeze.
No doubt.
Tracy and George, it's that time on our podcast when we ask our guests a few rapid fire questions to close our conversation. So I'm going to start with George. George, would you rather collaborate with a diverse team or work independently on a project?
Oh, collaborate with a diverse team.
How about you, Tracy?
Yes, totally collaborate and work collectively together.
So, Tracy, would you rather have unlimited data on community needs or unlimited resources to implement solutions?
I have to. That's a hard question, but I gotta have the data first, because the data dictates me to do it correctly. The resources is okay, but if I don't have the data to impact the community that I'm working on, so the data is part of me.
How about you, George?
I reluctantly have to agree because I know the spiff, but I really would like unlimited resources.
So you've really given your answer then. So maybe we can collaborate.
That's why the spiff is a collaboration. Tracy, you can get unlimited data and you can have unlimited resources. So this is my last question, and I asked this to all of our guests, although I was remiss in doing it last month, and thanks to all of our listeners who sent me an email to let me know I failed to do this. So I'm going to do this today. So George, you're reaching into that candy dish full of M&Ms. Are you searching for a plain or peanut?
Peanut.
George is the peanut guy. How about you, Tracy?
I am the peanut guy as well. So I have to admit that I am the peanut guy as well.
Absolutely. Well, thank you so much, George and Tracy, for sharing your time and your experience and your expertise with us. Thank you to our listeners for joining us on the Ohio Center of Excellence for Behavioral Health Prevention and Promotion podcast, Prioritizing Prevention. If you enjoyed this podcast and would like to help support it, please consider giving us a 5-star rating, sharing it with others, or posting about it on social media, or setting the podcast to automatically download on your favorite channel. Doing so helps us reach more listeners and keeps the conversation going. To catch all the latest from the center, follow us on LinkedIn, Instagram, X, and Facebook at OH Prevention COE, or visit us at preventioncoe.ohio.gov to sign up for our monthly newsletter. If you missed our last podcast, it was with Glenn Harris from the Ohio Domestic Violence Network. During our conversation, we discussed the importance of challenging harmful gender stereotypes, the impact of harmful masculinity on individuals, families, and communities, as well as strategies for promoting healthy masculinity and fostering gender equality. You can catch this podcast and all of our content on our YouTube channel or your favorite podcast outlet. This podcast was produced by Ivory Lloyd at Global Insight Productions and is supported by Angela Zhang and Jen Morrell at the Center of Excellence for Behavioral Health Prevention and Promotion. Thank you for all your work to get positive prevention content out into the world.
This has been the Prioritizing Prevention podcast. For more episodes, you can find us on Spotify, YouTube, Google Play, Apple Music, and many more. This program is funded by the Ohio Department of Mental Health and Addiction Services. For more information about us, please visit preventioncoe.ohio.gov. Thank you for listening.